Heidi McLarty is an occupational therapist who takes a holistic approach in helping her clients to build on their wellness and re engagement in activities and life roles. She uses a trauma informed, client centered, and strengths based approach to empower clients to make positive changes in their lives. Heidi, welcome to Elevating Women's Wellness. Thank you for being here.
Hi, Tara. Thanks for having me.
So, tell us a little bit about yourself and how you became interested in a holistic approach to occupational therapy.
Okay, so I am originally from the East Coast and I attended Dalhousie University in Halifax, Nova Scotia. And so after I graduated, I've worked in a number of different areas in the hospital in various capacities, as well as with children and in the community. And so over the years, I guess I would say that, I've tried out different approaches with people and with clients. And, back when I was working with kids, I was looking for something more. I was looking for approaches that really got to the root cause of what's going on in the body, in the nervous system. So I did some other digging and training over the years. And so I've done a lot of work with reflex integration, which is about the brain and how the brain works and how your body responds to things. And so through approaches like that, I really found, there's something deeper, there's something that needs to be looked at here. So instead of just using, a skills-based approach, there's a lot of movement-based kind of approaches that really help the body and the brain um, to really feel better and to function better. So and in addition to that, I also, over the years, grew a lot as a person in terms of my awareness of my own body and my own journey and my own process. And so, quite a number of years ago, I started looking into the energy realm. So, lots of people have heard of Reiki and therapeutic touch and those kind of approaches. So I learned my first Reiki class. It was about 6 years ago now, and so I kind of delved into that. And in recent years, I've been learning a lot more about how that all factors in. So to me, building on our holistic profession as occupational therapists. Um, I'm building into the other factors. So things that are happening in the brain and the nervous system, as well as the energy system. And just to back up to Tara, a lot of people don't know what occupational therapy is, even from the get go. So a lot of people think occupational therapy, they think, okay, well, you're getting back to work, or, it has to do with occupation. So yes, we can deal with occupation and we can deal with return to work and related things, but really occupational therapists deal with three main areas. So we deal with self-care, productivity, and leisure. So um, we also incorporate aspects to consider, the environment and what's happening in, the environment, what's happening with the person's function physically or in mental health. So there's a number of different things that we already focus on. But that being said, I was also really passionate about, looking at, okay, well, what's the root of what's happening in the system? So instead of just compensating and saying, okay, well, here's some equipment to use to become independent, which can be really helpful. I also want to know, okay, well, why is it that you can't do that, from a neurological perspective? Is there something off in that area? So I kind of like to look at the whole picture of the person, and we do generally as occupational therapists. But oftentimes when we have a referral, it's for a specific thing. So I really like to, take the specific thing because that is, leading to the issues that someone's having, but also ask about the other things and also incorporate, more the body and the spirit, as well as the mind as well, to support, what psychologists and psychotherapists are also working on. So yeah, in a nutshell, I like to kind of look at the whole picture.
Yeah, which I think is so amazing. And I love how you pulled together the skills-based piece together with the neurological system and like looking at the whole picture, because I do think it's very important that we get to the root. Obviously, there's certain superficial levels of support and treatment that we can offer clients or patients, but at the same time, there's possibly an opportunity to go a little bit deeper and do something that's more therapeutic to maybe resolve that superficial need by going to a deeper level, right?
Right.
Amazing. So thank you for sharing your journey and your passion. I'd like to hear a little bit more about the typical clients that you might work with.
So I see a lot of people who have had various physical injuries and are suffering from chronic pain due to those injuries. So as chronic pain can take a big toll on a person's functioning in all aspects of their life. So often these people are struggling a lot with sleep, even doing day-to-day activities around their home. And oftentimes these people are off work as well. And so I work with that group. I also work with a lot of people who have experienced chronic stress or other types of trauma, whether it be in the workplace or their own life in general. And so people with the diagnosis of post-traumatic stress disorder, or a lot of people will have, just if they don't have that diagnosis, they might, have problems with anxiety or symptoms of depression. And I also work a lot with individuals with post concussion syndrome. And with that comes a lot of, difficulty and dysfunction in day to day activities, including, how they're thinking about things and, just functioning day to day. Um, and another big group of individuals that I work with are people who are injured at work and they're off work due to the injuries.
Mhm.
So yeah, so there's various referral sources that I accept referrals from. So oftentimes insurance companies or the WSIB. I also see veterans through Veterans Affairs, and private people can refer as well.
Mhm. Yeah, it sounds like there's quite a broad range of different situations or scenarios that might be impacting people's lives, like you mentioned, whether it's leisure or work or day to day life.
Mhm.
It's amazing the breadth that there is there. Um,
Mhm.
if a woman is off work due to, potentially various reasons, what are the key elements for a successful return to work for her?
So primarily, I find that a lot of women who are off work, especially if it's been quite some time, is they don't really have as much of a routine established anymore. So they kind of get out of the regular times to wake up and get ready for their day, and regular meal times, or even just engaging in day to day activities. So I find a lot of women get stuck kind of in um, not having a structure or a norm for each day, which can be quite disheartening, and can really affect even their self confidence and their ability to kind of create some sort of continuum in terms of what they're doing. So I think to start off with, um, I get these women to really start with, adding in some more structure. So starting to try to get up at the same time and have meals at the same time and add in things into their day, right? So that they feel like they're doing something and they feel some sense of normalcy. Because when you don't have work to kind of structure your day around, days can become really long, and you kind of lose the meaning in things because you don't really have a set time you need to go somewhere and do something. So I think that's one of the key things to re-engage women who are off work, as well as finding more joy and meaning in something. So re-engaging in things that they enjoy as a start is a really important one.
Yes, yes. And why would you say that re-engagement and meaningful activities and life roles is important for women? Why does it matter?
Well, I mean, if you think about, what lights us up and what brings us the joy and meaning in our life, Oftentimes people put a lot of joy and meaning into their work. I mean, not always, but it's work is a big factor in people's lives. And so when they're off work because of an injury, a physical or mental health condition, we really need some, meaning and joy to come back in their life. And so even if it's just engaging in leisure activities that they enjoy, it's really important for their mental health and their sense of confidence in themselves. And, just starting to re-engage in stuff that's going to spark the joy and help them to feel better even a little bit. We can, build on that and help them to create that momentum, right, to work towards the bigger goals, which can seem more daunting. Like returning to work is often a goal for people, but it's a really daunting one. So we can start with the smaller meaningful things. Then I find that when women are feeling more joyful and empowered, and they're starting to do these things that they really enjoy, then it's giving them that confidence to go through the steps with more challenging things.
Great. Yeah, it makes sense. If you could build a foundation and take baby steps and do the things that are maybe the most exciting to do first, and then really build from there, it really makes sense to have that type of approach because I could imagine overwhelm may be an obstacle. Um,
Sure.
and so, with women that are, getting ready to go back to work, what are other common obstacles that they might encounter on that journey?
I find oftentimes because we as women are often thinkers and analyzers, and we're thinking about what other people are thinking. One of the big barriers that I come across a lot with women is, they're really worried and concerned about what other people are going to ask them or what other people are going to say at work, because they feel embarrassed, that they've been off work, and they feel like they need to share a certain story, or they need to kind of answer all the questions that come up. So I think that's a big barrier that comes up. And so in that case, I go through a lot of discussion with women, and I'll say, well, um, you can always give a short answer. You don't have to give an elaborate answer. You can give, an answer that's going to basically answer the question, and then, go on to something else, right? Because part of it is, as social beings, people are wanting to be social, and they're wanting to ask something to engage you, but, really they're concerned about you probably. And, going on to another topic is often fine. One of the other barriers too is the confidence level. So if a woman has not been engaging in the workplace, because of physical or mental health concerns, you know, the questions that often come up are, can I do it? Am I going to be able to perform? And what if I can't do it? And what if I get anxious, or, something happens? So what we do is we talk about the environment at work, and we talk about the different tasks and things that they need to do. And we try to, you know, foresee what might be the barriers and try to problem solve what might come up so that they feel better, kind of already having kind of problem solved it.
Yes. Yeah. I think that's a great approach in terms of like being able to strategize in advance and foreseeing that. And in a way, it's like leveraging if someone has that um, focus of maybe thinking or overthinking about it, you can actually leverage it for positive and foresee those obstacles.
Exactly.
hmm So earlier we were talking about brain and nervous system that you had mentioned. What is nervous system regulation and how does that actually help women with preparing for a return to work?
So thank you for asking that, Tara, because I feel like when I talk about the nervous system, I just feel like I'm maybe, talking really technically a lot. So it's great to be able to, put it out there and say, this is what I'm talking about. So when I talk about the nervous system, really the nervous system is a big way to say, we've got the central nervous system, which is our brain and spinal cord and nerves that go out to, control things. Um, but then we also have our autonomic nervous system. And so I'm really talking about the autonomic nervous system when I talk about self-regulation, because the autonomic nervous system, it has two main branches. So it has the sympathetic branch and the parasympathetic branch of that nervous system. And so basically, in a nutshell, the sympathetic branch of the autonomic nervous system, it's responsible for, the activation and, supplying energy to the various organs and muscles. um, and it's really like the gas of the system. And the parasympathetic system is kind of like the brakes of the system. So it helps our system to calm down and shift and into more rest and digest. But what I'm really passionate about is the polyvagal theory, which is basically there's a doctor, Dr. Stephen Porges, who's a neuroscientist. And so he added on to this view of the autonomic nervous system as not being just two branches, but actually having a third branch, a social engagement system. So it's quite interesting because when we talk about people who have had, a lot of stress or they've had trauma, what happens is, this system, our nervous system, which, we've got two drives for our nervous system: to be safe and survive, or to connect with others, right? So if we've had lots of stress, or we've had different traumatic things, or even chronic pain, what can happen in the nervous system is that sympathetic branch can be overly activated. And so people will commonly hear about fight or flight. I'm in fight or flight response, which is an activated system. So that can often get kind of stuck on, or stuck as being hyper responsive. And so then people feel a lot of anxiety and fear, and they feel their heart beating in their chest. And what happens is the parasympathetic system, or the ventral vagal system, because it has to do a lot with the vagus nerve, that doesn't get the chance to calm the system, right? So we don't feel safe, and we're more apt to go into kind of freeze or shut down. And so when I talk about self-regulation, it's basically the way that we ourselves can feel safe in the world, and we can help our nervous system to calm down and relax, so that we're not so activated.
I think this is such an important discussion. And in my own work, too, the nervous system is quite a focus. And this is a discussion I have often with patients. And I think you explained it brilliantly, and it is important to know. What are some tips that you might be able to share? I know it might look different from person to person, but how can we feel more safe? How can we activate our parasympathetic nervous system?
Well, a really big one from the get-go is really considering the company that you keep, right? Because, we have something that's called neuroception. So it's the perception, or it's kind of the your nervous system can sense other people's systems, right? So we all have an energy bubble around us, about 5 or 6 feet around us, that without even thinking or speaking or anything else, our system can sense safety and can sense connection. And so if we have an individual that we know and we're really feel comfortable with and feel safe with, then that's actually really good for our system, because we have this thing called co-regulation, where if I'm feeling upset or anxious or something, and I come into a room and I meet with you, and you're feeling really calm and relaxed, your nervous system state is actually going to help my state to relax and calm down. So when I say attuned to the company that you keep and the people you spend time with, you would really want to pick the people that are more regulated and you feel really safe with. because you're actually bringing your social connection system, the ventral vagal system, you're bringing that online just by hanging out with those people. Um, Aside from that, though, there's lots of different techniques that you can do. Deep breathing is a big one, to try to extend the exhale, especially, is often a really helpful and easy one that you can do.
Mhm.
So I really like that one. That one, you don't need anything extra to do that one.
Mhm.
That's a good one.
Great. Thank you for sharing that. And I think it's really interesting because people have probably had the experience of being in various types of company or people in different states and being exposed to them. And they might have a sense of intuitively that that's true for them, but maybe they didn't hear it described as co-regulation. I think that's really a neat concept to bring to the audience.
Yeah, well, and if you're finding, if there's people close to you that are also anxious and have some similar symptoms, if you're feeling um you're challenged with people that are close to you. I'm not saying, don't spend time with them. I'm just saying that you might be aware that, if the people are not overly regulated with you, then maybe you need to, try to go, find someone else, or even just connect online, even connecting through the computer, through video chat, or even spending some time in nature is a really helpful one as well, to ground
Mhm.
and just center your energy.
And how might women adapt their self-care practices in times of high stress? Because we know that, life ebbs and flows, and sometimes things are challenging. Other times we might have more flow or ease. But when things are more difficult, what can we do differently as women?
So, and I'm working on this one myself as well. And I find, I used to have a really um huge concept or huge expectation of myself, that if I was going to do self-care, I have to do it all or nothing. It has to be a big thing. And so in recent years, I've really realized, what? The most important thing is to continue on with the self-care, even in short amounts. The size or the time amount that you put into it is not necessarily as critical as doing things frequently to help your energy and to reconnect, right? So it can seem daunting, because I know a lot of women, and a lot of the women that I work with, it's like they have a really high expectation. So they're expecting themselves, well, I need to do, an hour of exercise a day, and I need to journal, and I need to meditate, and I need to do all these things, which can be quite overwhelming. So we know from the research related to habits and forming habits, the regular continuity is really the important thing. And so doing something regularly, even if it's a small thing, is going to build a habit more than if you were, you're not going to build a habit if you do, a long period of time here, and then, you wait a week and then you do it again, right? So just breaking it down into smaller parts is fine. If you can just find some time to yourself to do some breathing or try some other things, and
Mhm.
that's a great start.
Yeah, that consistency really matters. And I have a final question for you as well. So, resilience is a topic that is important to women's wellness. It's a topic that I love and I think is so important as well. What does becoming more resilient mean to you? And how does this relate to the women that you work with?
So, I really feel that resilience has to do with empowerment
Mm.
and feeling more confident. So, if we have more understanding of what's happening to us in our system, it can really go a long way in terms of helping us to feel resilient, because through that understanding, then we're able to have more self compassion for ourselves, and we're able to, build on that knowledge to then advocate for ourselves, right? So so for example, a lot of people with post-traumatic stress disorder, they don't necessarily understand why they're hyper responsive to things, and why, they want to, get out of situations really quickly, and their friends and family don't often understand. So, when I explain to them, well, this is what's happening in your body, and this is why your body's responding that way, and why don't you consider that, maybe that time of day is not the best time to go engage in that activity, or maybe you could bring somebody with you to feel more safe, or what else can you do. When they feel empowered with the knowledge of what's happening, and then they're given the tools to learn what tools and strategies work for them, it really goes a long way to feeling more resilient and more empowered.
Amazing. Yeah. So it's about the self awareness, the skills, the tools, the resources, and even relationships, right? How our relationships support us too, in becoming more resilient and feeling that confidence.
Right.
Awesome. Well, thank you so much for sharing your perspective. It's been so informative to have this discussion. And I know that it'll really help our audience for, on various levels, whether it's a woman that is preparing to return to work. But I think there's really something for everyone to take away from this episode. So thank you so much, Heidi.
Thank you, Tara.